Hi everyone, welcome back. As discussed in the previous video, in this video we are talking about creep. Creep is a property of our tissue that helps it to twist and turn without snapping our tissues. So it's a good thing unless and until we overdo it. Let's discuss something from our last video. The intervertebral disc consists of certain substances that attract water. So when we sleep overnight, our intervertebral disc height restores itself by attracting water into it. Gradually over the day, what happens is that the intervertebral disc height reduces as the water starts to seep out. So this process when happens over the day and we are sitting for a very long period of time or standing for a very long period of time, the water continuously seeps out, and that is when creep sets in. Let us understand this a little bit more with the analogy of tire. So when the tire is full with air, at that time the height is maintained of the tire. But what happens when the air comes out? The tire height reduces and thus bulging out. So similarly, imagine that the intervertebral disc height reduces when the water seeps out and it bulges, leading to maybe herniation or disc bulge. So in this video, we will be talking about how to prevent creep. But in the next video, we are going to talk about the biomechanics of our back by knowing more about our back muscles and also our abdominal muscles and the exercises related to it. So if you are someone who is sitting for a very long period of time, so what you can do is every 15 to 20 minutes, you can stand up. Okay. So you can stand up and do some movements of your body, like some hip rotations you can do, maybe some kind of, like punches, and little bit movement of your upper body, little bit side movements like this. So this will give you a little bit of motion to your entire vertebral column and delay the creep to set in. And if you're not able to stand, then you should, extend your legs and cross over your legs and, cross over and sit on your chair. So by that there will be a little bit movement in your back and little bit movement in your hip flexion as well. So if you are someone who has more of a standing job, so what you have to do is every 15 to 20 minutes, you have to do some kind of calf raises. So you can see here, you can do some calf raises like this, okay? And try not to put entire pressure on both of your hips. So what you can do, you can dip on one side of the hip and the other side of the hip. Sometimes you can do your leg marches like these and some upward marches. So this will give motion to your spine as well and delay the creep to set in. So the crux is you have to keep in mind two most important things. One that I told in my previous video, that is maintaining your lumbar lordosis, and the second one is to keep changing your position. Because when you sit for a longer duration of time or stand for longer duration time in the same posture, at that time creep sets in. So changing your posture is what is the most important thing you have to keep in mind. By that your back pain will reduce definitely.